we designed the study to compare the ability of histological diagnosis between novel EUS-FNA 25-gauge needle with quad trap and the standard 25-gauge needle for solid pancreatic masses. This is a core needle. As you know, this core needle has a reverse bevel, what we call quad trap, at the tip of the needle. The study was Multicenter Prospective Randomized study. Patients were recruited from April 2013 to September 2013. Consecutive patients with pancreatic solid mass presented to 8 referral centers for EUS-FNA. Randomization was conducted by using random number generator. Regarding EUS-FNA, we used the slope flow technique for both needles. The stylet was out without suction while moving the needle to and fro 20 times. Only a single pass was performed for this study. All samples were inserted into formalin bottles with a stylet and processed for histological analysis without rapid on-site evaluation. This slide shows the process of histological assessment. All samples were inserted into formalin bottles and fixed overnight. The samples were spread onto the mesh sheet, and the samples are stained to make it easier to recognize them later. And then we processed the samples for dehydration and embedded them with paraffin. After the cooling the block slowly, the mesh sheet was removed. And then we completed the paraffin block. All tissue samples were brought to one facility and processed using same technique. 10 slides of serial sections were prepared, and number 1 and number 10 slide was stained with hematoxin alzines first, and 2 experienced pathologists reviewed the samples independently. Both pathologists were blinded as to which needle was used. The final diagnosis was made based on the surgical histology, and in non-surgical cases, the final diagnosis was made based on the follow-ups for at least 6 months with global clinical and radiological assessments.